Thank you so much. We are recording, ladies and gentlemen. I'm so happy that we're all here, and I hope you guys are as excited about arts and health and the arts and health space as I am. I'm newly in the space, but I've been excited. Also, I'm saying newly in the space, but like some people might argue with me because I've been in this arts and health space for 10 years, but it still feels very brand new for me because it's like budding and it's growing and everything is exciting. And every day there's something new that's happening. So that's one of the reasons why I'm so excited to actually be here with everyone today. But I'm not going to take up too much of your time. I'm going to introduce our first speakers. We're going to be talking about decolonizing global health through creative research methods. And that's basically the conversation that we're going to start engaging with as we begin segment B today. And with us is Dr. Ranjita Dhital, who is a lecturer in interdisciplinary health studies in the Arts and Science Department at the University College London. Dr. Ranjita, hi.
Hi, hello, can you hear me? You can, brilliant.
Loud and clear.
Excellent, I can hear you very loud and clear and see you clearly too. Great, thank you.
Oh, that's perfect. That's great. Also, along with Dr. Ranjita, we have Stephanie Chang, who's also the Arts and Sciences graduate at University College London. She is the UCLA Arts and Sciences. She's part of the UCLA Arts and Sciences Department, Faculty of Arts and Humanities at also the University College London. Hi, Stephanie. How are you doing?
Hi, I'm doing great. Thank you.
I'm so happy to hear it. All right, let's get started. Let's hear your guys' thoughts on, I'll start with Dr. Ranjita. Let's hear your thoughts on decolonizing global health through creative research methods. And I'm essentially just going to hand over to you. I'm very excited to hear your thoughts.
Thank you very much. I'm going to share my screen, so please let me know that you can see my slides. And thank you. Oops. Share screen. I'm going to try to right, let me just see. I don't know why it's not working. So I have slides.
You can share your screen. I've made
oh yeah, I think it's working. It'll work now. That's it. Can you see my slides? You can see my slides. Great, brilliant. Thank you very much. Excellent. Great. So thank you very much. And so, I'm going to present to you sort of my current thinking and my current practice in research and how I got here, because I think it's good to hear about journeys, because things like what I'm presenting, it hasn't really been written and described as a pathway of how to do. And before I start, I'm going to give you kind of a little bit of a background about me. So I used to work as a pharmacist. I'm still a registered pharmacist. I used to work as an addiction specialist pharmacist, and then in public health. And then I now I'm no longer clinically practicing, but I'm now working full-time as an academic. And it was whilst I was practicing, I became very interested in research. I had lots of questions, and I felt that my practice, I needed more. I needed to explore ideas more. And I'm also an artist. I sculpt, so I have this dual kind of interest, arts and sciences, and I've kind of kept them very separate until I kind of started combining them for my research. So I have this kind of diverse and this background, it's like a dual background. And I'm originally from Nepal. I was born there, and I came to the UK when I was about 8, and I've always been connected with Nepal in some way or the other. And my research was sort of very based in the West, and it's only sort of now that I'm kind of looking at my work and how it connects to kind of global health and looking at creative health as well. So just to give you an overview, so the talk will be looking at like disparities about global health, what is happening in terms of health problems, and about what do we know about knowledge and how to kind of do research, and where that knowledge comes from, which comes from majority from the global north. And then what does it mean for us now what is this new future? What could that look like? And those are kind of the areas that I'll be exploring very, very briefly, and give you some context. In the UK, because that's where I'm living in London, there has been an increase and a positive kind of development of this sort of arts and health movement. Governments have supported schemes, there's been reports published, there's been a scoping review that was published looking at with the WHO, showing that there's a lot of research in this area. But a lot of these ideas and even the research that's been critiqued, they are kind of still from Europe, majority from sort of Western countries, and very little kind of sort of really kind of rich insights and understanding and research that have originated from the global majority, very little. So it's still a very Western paradigm that we have. And it's surprising considering the health problems that exist in the world. And this is a data from our sort of the data world data. And you can see this, I'm just gonna, I don't know if you can see my pointer, but in this box, you can see top here is deaths, well, not deaths, but sort of, deaths and disability, looking at the disability adjusted life years, that injuries have stayed more or less the same since the past 30 years. And you can see this red band, and it's sort of narrowing, and that's the communicable diseases from microorganisms and infections. And that's reduced because we've had increase in technology and sort of knowledge about managing sort of infections and other health conditions, and that's been made available to many parts of the world, so it's really decreased. But when we look at non-communicable diseases, so these are things like caused by behavior and social and cultural systems in our sort of way we work, where we live in our society, so the structural kind of systems have resulted in actually an increase in non-communicable disease, and that's really surprising. And so here, 74% of all deaths worldwide are from NCDs, non-communicable diseases, and 77% of that burden of death and disability falls on low middle income countries. So if you are living in a poorer country and you had you were drinking, for example, and you also had poor nutrition, and you're going to have much sort of worse health outcomes and social and cultural community outcomes from that than if you're living in a more affluent country. So there's a huge disparity, and the NCDs, the cause of them are from things like tobacco use, physical activity, harmful alcohol use, and diet. So this is what I want to kind of give you a context. And therefore, why is it now we're in 2023? Why do we have that sort of data? So it made me really kind of question, where does knowledge for research comes from? What is its origin and its history? And I don't know if you're familiar with this sort of term, the weird. There was an article written by Joseph Hendrich, sort of I think about 10 years ago, and about the weird, about knowledge coming from sort of the West, and by those who are educated in the West and in industrialized countries who are rich and so-called democratic. And the kind of knowledge that's produced it makes an assumption that everybody is also like people from the West. So when we do health interventions and they come up with something that works, there's an assumption that this will be universal all across the globe. And also all the knowledge has been coming from the West. There has been a lot of, even we're speaking in English, and a lot of things that are published are in English, and also what is funded, what gets sent to different parts, like funding streams and bodies that sort of fund research in other parts of the world. In the global majority, the funding bodies may stipulate a kind of requirement that the project has to be done in a certain way that could be contra, in fact, could be kind of really kind of not context specific at all, that wouldn't work in that part of the world. So this is a really kind of mismatch of the needs of the global majority and those who hold the power, the knowledge, the so-called knowledge, the Western knowledge, and what can be done. So I just put here some sort of articles that I found that was looking at this disparity and the reality. And these are quite a recent paper, so this is still an ongoing debate and a discussion. And it's not just about sort of publications. We're looking at the origin of theory and framework of research. And I've got here a framework that's used quite commonly, called by the Medical Research Council, on how interventions should be designed. And this sort of follows a kind of sort of a cyclical reflexive pathway. You start with the development stage to understand the problem. There's some feasibility in piloting. You evaluate it using like a trial, then you implement it. And this sort of framework, what happens is they kind of focus on a specific disease, like, for example, TB or HIV, and the focus is heavily on that. But when you look at the complexities of the world, in reality, what's around us, health and social care, our communities, everything is connected. And there's kind of a limitation of using purely this type of framework, and a lot of funding and sort of the idea of the creation of knowledge is based on this. So really, this really doesn't suit the reality of the global majority. Or I can't change my slide. No, there we go. So, I mean, I have been part of this. I did my research previously when I was in London, following that framework. I looked at, when I was working as a pharmacist, I looked at ways that pharmacists could talk to the public about their drinking and reduce harm. And my kind of peers, the people I did my research with, were all from a biomedical background, and that was kind of really a specific area. But I found that the pharmacists really enjoyed that there's this new kind of role that I was developing for them. The patients enjoyed it, but this trial that I designed, which was actually the first trial, didn't actually work, and it wasn't effective, but it was very feasible. So I just felt there was something else missing. There was an active ingredient missing that could look at creativity as its active ingredient in the design of the research. So as I mentioned at the beginning, I'm originally from Nepal, and I wanted to look at global health, and because you saw the disparity in the problems and what the global majority experience in terms of health. So I thought, I'd like to go to Nepal and find out more. So last year I created a network called the Creative Nepal Arts Health Community. And I wanted to explore, bring together people from an arts background, health and entrepreneurial business, to come together to discuss about health in a totally different way. I didn't know what that was going to be like, and neither did they. And we've now formed a network, and we hold online events, and we're kind of creating this debate and discussion that's led to me applying for research funding from the experience and the exposure that I've had. And this was some images from our network. It was very enjoyable, very, very kind of lovely to see so many different types of people come together. So just sharing that with you. And so really now I feel, well, this is really important here. We're looking at methodologies, expanding how we do current research, and not just from this, what's happening, but also I wanted to highlight some documents and reports recommended by the WHO and other organizations. They're now talking in a different language that I haven't heard been said in this way before, from about 5 years ago, even, like the WHO are now talking about meaningful engagement, wanting community engagement and how important that is. And you can see things about transformational change, looking at the system level. When I showed you that the medical research framework, it was sort of looking at intervention level, but now we're looking at sort of joined up, connected things and organizations and ecosystems and workforce. So this is a really kind of interesting time where creativity could really kind of complement this and really sort of strengthen it. And I wanted to show you this image. It's a painting by an artist I really like, Ed Gray. It's showing an image called in Edgware Road. It's called the Old English Gentleman, and that's the name of the pub. And here you can see so many different people are drinking alcohol, the way they are socializing in so many different ways. And if you were designing an intervention, that intervention wouldn't really be effective to so many of these individuals here. You'd have to really kind of tailor it. It wouldn't work. So you really need to look at it from a kind of ecological kind of systems approach, community approach, participatory approach. And even the language that we're using in research, quantitative, qualitative, mixed methods, should really be reviewed and changed And I prefer the term multimodal sort of method. We're looking at, if it's creativity, then the outputs can be creative outputs, poems, paintings, murals, film, different outputs that kind of give us a really interesting insight into the community that we're exploring with. And kind of using participatory approaches to understand. So at the early stages of a research, before
yeah, I'm going.
All right, I can hear something in the background. Okay, so really this then, you know, at the early stages is so important to explore that, and then maybe you can later do a randomized controlled trial testing something. You could do a sort of longitudinal large study to see whether the approaches that you've, like a suite of options that you've kind of decided on, could be effective over a long term, like a cohort study. And there's different ways you can do very, very large studies from having started with some creative methods at the beginning. So looking at sort of interdisciplinary to transdisciplinaries is where I think creative global health research could go. And this is not new. A lot of scholars have been doing this for some time, some really lovely work out there that's been published. I went to a really lovely conference a couple of weeks ago where I presented my work in the UK, in Manchester, the International Creative Research Methods Conference. And it shows, and I'll just show you some images of some of the books that have been published that are available. And the titles are really great. Doing Rebellious Research in and Beyond the Academy. You know, the research, creation of knowledge is not at the realms of academia only. You know, we are all co-creating knowledge. We are all researching. So that was a very, some other books for you to look at. So really, this is an exciting time. So I spent the summer in Nepal and I got back, and in my time there, I was developing the research project that I had been given funding for, looking at alcohol use and the relationship of alcohol use within the communities. And, you know, I saw so much creativity alongside difficulties and problems. And you can see here that, you know, the images that I took, some really beautiful, sort of, there's beauty amongst, you know, ordinary things. And it was really nice to see that. And I have a kind of an interesting kind of perspective. I'm an insider and an outsider in Nepal. And when I talk about what I see, some people are going to find it unusual or different, but I really enjoy this kind of experience of exploring. And indigenous knowledge, you know, there's so much there. I feel the knowledge that we have in our sort of really ancient cultures has been lying dormant. It hasn't been brought into our modern world, and how we could connect with it. And really engaging with it could be a way of revealing sort of ways of knowing, sensing, and being. And I really kind of feel quite excited about that. So I have a special issue out coming summer next year. I'm an editorial board of the journal Perspectives in Public Health. And in that, I'm inviting contributions from here, from our Global South Arts Health Week community, to submit something about your work. And I'm not just publishing sort of traditional research papers. It could be different types of outputs, including sort of artwork, poems, prose, the process of you starting a new research approach, your stories of kind of contributing to this creative global research movement. So I wanted to end with really, you know, where I am at the moment. I feel my journey, you know, is still continuing to how I started. And I'm quite excited about this current research that I'm doing. I'll be presenting more about this on Sunday of the alcohol study. But my researchers who are working with me, my colleagues, Gsahw Kunar, who's a researcher in creative health, who's based in Kathmandu, and we have Kate Luxian. I think she's on they're on the call at the moment, a research fellow in creative global health. And sort of, you know, we're learning from each other, and it's been a really great experience. And then we also have really pleased that you've invited Nepal to be part of your network. So we have the Global South Arts Health Week Nepal Associates, festival directors, so Bibag, Jungal, and Sangeeta Thapa. So really looking forward to working with your network more going forward. So thank you very much. And if you have any questions, you can email me. You're very welcome to join the Creative Nepal Network as well. So thank you very much. I will stop sharing. Hi, Rita.
Thank you so much, Dr. Ranjita. I've
Okay.
specifically loved that you touched on participatory action research, because it's actually been one of the key things that has moved arts and health and arts and medicine, specifically within the South African context. So that's been one of the key things for us specifically that has kind of moved the majority of our work forward within the practice. So I love the fact that you also touched in on Indigenous work and Indigenous knowledge systems, because that's also something that we've that has contributed a lot. There's a question. I'm going to take two questions just so that we can move to Stephanie, and then we'll go back to a general Q&A afterwards. We have a question, I'm guessing, from YouTube. How did you get the community involvement? And what were some of the challenges that you faced specifically with that community involvement?
Okay, no, thank you. So I completed a research project during COVID in Nepal a couple of years ago, and that was, we had researchers in Nepal, and so they had experience of doing mental health research previously. So it was about sort of developing the work sort of force there. And also it was kind of a difficult time. But what I'm doing now, I was in Nepal, and I can sort of understand Nepali, but we're kind of with having that Creative Nepal network, I think has been really, really important, because through it we're learning from each other, and people have already been naturally involved. So it feels like a natural process that started since last year when we launched the network. And through it, we've kind of been introduced to other people, and they've been, it's almost like a snowballing sort of effect. And then we kind of relationship building, what feels right, what feels natural. And so we're at the early stage of this new project. And through this, it's a knowledge exchange project, looking at the early stage of how alcohol affects people, and the more cultural and community assets that exist that could help reduce drinking. So we're hoping that through this sort of relationship building and shared understanding, and then everybody, we say, is a co-producer of knowledge. We're not looking at it from a hierarchical traditional research. So the way we're doing it, I think it seems to be the way we're going. So we're really kind of observing and mindful of what our process. Thank you.
Thank you, Dr. Ranjita. And thank you to Miriam for that question. That was a question from Miriam. All right, we're going to have another Q&A at the end after we've heard from Stephanie, but I'd like to invite Stephanie Chang to also come through and also give her thoughts specifically about this topic, decolonizing global health through creative research methods. And it's really important that we do have creative research methods, because everybody in the arts and health is a creative in some way, shape, or form. Stephanie, welcome.
Great, thank you so much. I'm going to also share my screen. Hopefully this is being shared. Okay, there we go. Thank you. So hi everyone. Firstly, I'm really excited to be here today, and I'm very much looking forward to this interdisciplinary arts and health exchange this upcoming week. So my name is Stephanie Chang, and I am a recent graduate of the Arts and Sciences program at University College London. I am a cultures major with a minor in health and environment. So I am based in London, UK at the moment. I've been mentored by Dr. Ranjita Dhital this past year throughout my journey in the field of arts and health, and I'm further learning as a member of the Creative Nepal Arts and Health community to explore creative research in global health. So today I will be sharing about a recent research that I've conducted as part of my final year dissertation project on analyzing arts-based health initiatives in sub-Saharan Africa through the lens of culture. Just to introduce myself and how I got here today, my sort of immediate and quite literal resort for wanting to combine my love of drawing and medicine was medical illustration. So really any opportunity I had to portray the human body and health as a theme of my artwork, I would choose to do so. But soon enough, I realized I wanted to play a bigger role in addressing global health inequities and wanted to do so in a way where I didn't have to necessarily lose a part of my identity, which was as an artist and a creative thinker. Having said this, I am definitely a newbie in the world of arts and health, and ultimately there are two key events that have really defined my interest today. Firstly is my internship at AfriKids UK, which is an NGO for children based in Ghana. It really greatly shaped my outlook on how I, as a foreign researcher and volunteer, could do what I can to really support the bigger values of health and equity for all. So in particular, their work in eradicating the spirit child phenomenon really taught me one of the biggest lessons that stuck with me, which is that global health challenges are very multifaceted in nature, and it is important to sort of undertake a conscious approach to value one's culture in addressing such health challenges or particularly harmful practices. In doing so, locally led solutions that really truly bring change within the community can be developed. Coupling my experience with AfriKids was a module I took in my final year of university, the Arts and Science of Public Health, that was also taught by Dr. Dhital. And within an academic setting, it was my first time as a student seeing coursework that was not solely set in the context, a very familiar Western-centric context. And I learned then that there was an entire world of arts and health that I yet to come across myself. So kind of encompassing everything I had learned, I wanted to contribute to the breadth of research being conducted in arts and health from a global non-Western centric perspective, and contribute to the movement that is the decolonization of health and sort of looking beyond the idealized standards of health and their delivery. And ultimately, I found that there was a gap in research when it came to guidance on how arts and health researchers can better design their interventions from this standpoint, and doing so in a creative manner. And I believe that the first step was to investigate how past arts-based research initiatives, including direct community interventions, were being conducted, and to ultimately inquire whether cultural awareness was present. That's my exploration of what it meant to take a cultural approach in the arts began. Through my study, my sort of main research question was, how have researchers been culturally conscious in their approach to research arts-based initiatives in sub-Saharan Africa? So I sort of explored the discourse embodying the relationship between arts, culture, and health to contribute to a quality evidence base in supporting the global application of arts and health and creative health. Now, my interpretation of culture and cultural consciousness was greatly influenced by Collins O. Erhiambua's PEN3 cultural model, and this was created as a framework by which health researchers can better understand the relationship between culture and health and utilize it for interventions beyond the West. And I chose to base my study on arts-based health initiatives, specifically in sub-Saharan Africa, sort of recognizing the great cultural diversity, complex identities and heritage of the communities. One significant idea that I tried to be really conscious of was ensuring that I wasn't necessarily influenced by any sort of biased narrative that emphasized the indigenous forms of art as the prime, the authentic form of art to represent the culture of African communities, and that there is indeed room for innovative art forms as well. So to briefly summarize my methodology, I conducted sort of a multi-method qualitative study to assess the final 28 papers from the viewpoint of the researchers' role and reporting of their studies. So this consisted of an inclusion-exclusion criteria against an existing set of papers on arts-based health initiatives, and it was followed by a thematic analysis and final extraction of the themes pertaining to the research design and methodology. there were a total of 5 themes that were extracted. The significance of choice in arts-based mediums, recognition of the role of language, the generalization of African culture, conducting community-based background research, and working with local figures. But for today, I want to focus on 2 out of the 5 themes and really dive deeper into how it can sort of provide insight into ways by which creative researchers can be more culturally conscious. With the theme of the significance of choice in arts-based mediums, there was a lot of assumption in the discourse of the studies. The assumption of which art forms would be the most accepted or interpreted within the community in the same way done in the global north, or even the assumption that mass media art forms would automatically be the most ideal form for any public health intervention, regardless of where it was conducted. Because there is so much cultural diversity and the breadth of arts in the global south is so rich and different to the art that may be known in the global north, it is really important to really position the art form within the cultural context of the community by which the intervention is taking place. And to do so, we really need to take a step back and first and foremost, try and understand and shape the definition of art based on how it is observed and practiced in that community. It's that initial conversation, whether it's formal or informal, to be curious, to wonder and to inquire one's perspective and culture so that the creative research or art form being utilized can really be effective. This extra yet quite critical step could help researchers go from sort of amplifying the use of the arts as something that is familiar to the community to then taking a step further and introducing a new art form in a more creative and innovative way that can still be culturally adaptive. Secondly, working with local figures was a theme that was represented that kind of represented the active effort to integrate local figures into the health initiatives. So the primary way that was being used was hiring local workers to deliver the arts. So actors for plays or peer educators to facilitate following discussion groups. And it was seen that studies that employed such methods were more useful in connecting with the community or delivering a certain health message. So utilizing community-based active participatory research methods for arts and health interventions is also very critical. All in all, and to sort of wrap things up, I believe that such platforms that spark art and cultural knowledge exchange between artists, researchers, and health professionals from the Global South, such as the Global South Arts and Health Week, is extremely valuable, and I look forward to learning more about the creative initiatives in the many different participating countries this upcoming week. Is all. Thank you.
Thank you so much, Stephanie. I didn't know that you've been working in my backyard. I'm just saying, little hurt that I didn't know you've been working in my backyard. But I'm very happy to see the kinds of creative ways that we've been thinking about research, and especially you and Dr. Ranjita. I think it's really nice to see that we're sort of looking past research just being data and numbers, and also looking for how meaningful. It sort of reminds me of the most significant change method, where the stories and the actual impact that we do in communities is what counts in furthering the research, which is really beautiful. All right, so moving on swiftly to the next part of our segment. Let me just quickly ask, is there any questions? Any final questions for Dr. Ranjita and Stephanie before we move on? All right, we have some comments. Really interesting, thank you. National and local variations in cultural form seem so important to consider. Thank you so much, Hannah. Yeah, okay, I guess we don't have any questions, but there is still time to interact with Dr. Ranjita. As you saw, she even gave y'all her email. She's a braver person than I am. So you guys are more than welcome to email her and ask her questions whenever you feel up to it. But moving on with our program, very exciting program, I must say. We are going to be discussing photography for better sanitation and empowering women in vulnerable communities to voice their own experiences. And with us during this conversation is going to be Shibaji Bose, who is a consultant and visual research methods lead, Brown Goal IDS Sussex. Shibaji, are you here with us?
Yeah, thank you. Thanks so much. I will, if you can pick up the slide, it would be of great help. Yeah, thanks so much. So it's actually, it's a privilege to be part of the GSHW movement. So I'm Shibaji Bose, and as you have mentioned, my credentials, and I'm with my colleague, Dr. Hannah McPherson, who will lead the discussion. We'll talk about and exchange learnings on participatory visual methods like photo voice, photo elicitation, and embedded photography, how it can gather the perceptions from the point of view of women from different sites in Africa and Asia as part of the Brown Gold research project. We have designed it more as a sharing session to learn from your experiences as well. So just beginning to it, globally 3.6 billion lack access to safe sanitation. Some very stark facts. In Nepal, one of our sites, for example, 93% of municipalities lack working sewage treatment plants. So the risks to health are very high. So while approaching this, we explore how our participatory visual methods can help in the development of better sanitation and awareness about it. And we did it by gathering the perceptions from the point of view of women from different sites. So our starting point for this project is that such challenges can also be an opportunity to rethink and reimagine this off-grid towns as a fertile ground for people-centered, inclusive, sustainable innovations. Next slide, please. Yeah, thank you. So this is the map in which of the Brown Gold program, in which different sites in the countries that are located. So if you look at, we have War, northern Ghana, and the top left, the picture there, which is taken by a woman of what she thought as important through this photo voice process. Then the top right is Tigray in northern Ethiopia. And if you look at the bottom, it's Guleria in Nepal, the plains of Nepal, very near to India as well, on the bottom left, in which we used photo voice and photo elicitation, both participatory techniques. And then you will see towards the right, extreme right, the Nanded town, a town in Maharashtra, which already went through the CLTS process, the community-led total sanitation process. And in the middle is the photo elicitation, in which it's still ongoing. It's in the coastal town called Aleppi, which is the backwater, the southern tip of India. So we asked how, in these processes, we asked how do local communities perceive, experience, and live with off-grid sanitation challenges. And we also asked how these locally appropriate resource recovery and resource innovations be facilitated to be socioculturally acceptable and socially inclusive. Next slide, please. One of the highlights of this project was to use photo voice to center the voices of communities and sanitation workers by inviting them to share their beliefs and perceptions within the frameworks of understanding and exploring their experiences of contending with unfolding uncertainties around sanitation, water, and health. Now, this photo voice method, this embracing of this indigenous lens and letting go of researcher control, and also flipping the gaze and looking through the gaze of the community through the photo voice, was facilitated in all 5 Brown Gold sites. this experience has helped unearth the pastoralist, voices in some cases, and implicit narratives and the understanding of social and cultural determinants of health. So in this picture, if you see that after the initial orientation to the use of this technique, in which we were mere facilitators, they were the primary researchers. Now the participants, the women are learning to use a mobile camera. So in some sites, the women have never touched a smartphone, which was, because of the patriarchal norms. In most cases, the fancy smartphones are generally with male member of the family. Next slide, please. Next slide, please. Thanks. So photo voice in its simplest sense is about giving people cameras so that they can take photographs and tell why they took these photos and why they think it is important to them and their community. This method is usually embedded with people where the researcher or the visual methods practitioner has either walked earlier or has an interlocutor with rapport with the local community. Now, this technique involves a group activity, and hence the voice in the photo voice is also an acronym. It's basically the voice of individual and collective empowerment. So after everybody has taken their photographs, what we do is this group sit together, discusses the photos and the accompanying narratives, and selects pictures and descriptions. The priority issues and themes are decided by the group, who then present it to the local community to validate their experience. So it's experience being validated for the individual, at the group, and then at the community level. So in the earlier, slide, you see that there's a fortnightly group meeting being, happening. And the researchers there are showing the pictures downloaded into the laptop in the earlier slide, taken by the community to know why they take these pictures. Now, this slide, if you see the top left picture, this is a picture of a mock session on presenting it to the local policymakers. That's what that is. And other pictures are from a policy event in Guleria, Nepal, where the community representatives present the photo evidence and the narratives to the municipality. So interviews with the women after this process was completed, interviews with women later revealed, and it's very interesting that the women think that the photo voice has actually enabled them to take a man's place and do a man's job. And they feel proud that they too can be the voice of the community. Now, this sends an awareness of the change within them is one of the critical aspects of the photo voice, where evidence-based storytelling with pictures and narratives helps to communicate the indigenous and implicit knowledge of the marginalized living in these remote off-grid areas. Next slide, please. Can you go to the next slide, please? Yeah, thank you. So this brown gold projects, we had a interdisciplinary and transdisciplinary team, which brought together social science, engineering, microbiology, and creative arts experience and expertise to help facilitate this bottom-up processes. Now, this is one of the examples. The earlier one, please. Can we have the earlier slide? Yeah, thank you. I will tell when I need a change in slide. So if you see on the left, there are, this is a sheet, on both the, the photo elicitation process chart. Now, these photos were originally taken by the natural science researchers. And so these photos, and then they had a flow chart, if you see in the middle of the entire sanitation process, the ideal sanitation process. And then we showed it to these pictures to get the reflections from the community around themes that were not easily articulated verbally. So the understanding experience of the sanitation chain through this photo elicitation, study, and with interviews, we investigated the sanitation experiences and community perceptions of the sanitation change. And what it helped us is, this method helped us to reveal insights that might have been might have remained hidden in more conventional qualitative and quantitative analysis. For example, we discussed with the participants, diseases manifesting from unsafe disposal of fecal matter and toilets getting waterlogged during the rainy season. Now, this actually led to discussions on healthcare access and healthcare financing and expenses from going to state and private hospitals for treatment. So in fact, what happened is these iterations with the community, the narratives and the reflections which we receive from them, now they informed a change in the fertilization chart that we and the social sciences and the natural science researchers has met. So if you look at the left bottom, so it has the community wanted that the pictures have good and bad practices along with the sanitation chain. So this actually underwent a change based on the community, reflections from the community. Next slide, please. Can we have the next slide, please? Yeah, thanks so much. So this is an example of photo voice, which was ongoing, and here the initial findings and evidences are coming out through this process. And if you see to the left is the drainage systems in Nepal. Women, took a picture emphasizing the importance of the drainage system in this, vulnerable portions of the municipality. And on the right, this picture they took in order to convey the water scarcity in northern town in Ghana. Sorry, town in northern Ghana. So what they talked about, in the narratives, they talked about the direct relation to health, especially of the children. The rise in incidences of health emergencies in the monsoon, like exponential rise in diarrhea cases, number of deworming episodes that the children have to go through, lack of quality control in water supply, access to drinking water in the summer month. And as one young mother in Bose, it's a trauma for mothers of small children every monsoon. So this we are getting these initial findings out of this process. Next slide, please. Yeah, thank you. So this came from the Nanded district, Nanded town in Maharashtra in India. So here it's actually through this through the clicking of the pictures and the narratives, they actually wanted to show the predicament of the migrants who travel to towns and big cities to earn their living. Now, this they thought can be an effort to share the challenges presented by using visual methods to capture the experiences of a often vulnerable migrant population around WASH. And the pictures and access to clean water, availability of proper toilet facilities, and adopting personal hygiene practices by the migrant population to cope with their sanitation challenges, and some of which also borders around the human rights issue. Thank you. Next slide, please. Yes, thank you. Now, with the women photo voice group, this was something we were not expecting, but it came. So if you see these two pictures from the women photo voice, this one element was common. Now we had several other pictures, and we had pictures of unending stream of their daily activities, which often remain unpaid and hidden. These become great entry points to start a conversation and evoke actually a range of responses. And embracing of this co-produced visual method by the community, was provided the researcher with an, within quotes, intimate understanding of how this women contained with and engage with different aspects of WASH. This was something that laid hidden, and it just cropped up through this process. Next slide, please. Next slide, please. Thank you. So this was a study which spanned several seasons. for the last 6 months, and we got pictures from, different places and different sites. And so what when we actually went in for to get their experiences of sanitation, but we didn't constrict it to only sanitation. So, and, kept the range quite high of what they want to do. So this pictures, if you see, they're pictured erratic rainfalls, sometimes heavy rainfall within a span of 3-4 days, leading to flash floods, long summers resulting in drought-like situations. Now, one of the recurring theme from most of the sites is a variability in weather. It's growing unpredictability and difficult to anticipate, and that it is leading to uncertainty in cropping, sowing, and uncertain yields, and resulting in food insecurity of the family and increasing in intensity of heat spells. Now, already when we talked with them towards the end of the photo voice method, they were saying this change in weather and climate is worrying. Now, they actually may be alluding to the climate change effect being felt by largely the agrarian populations across Asia and Africa. And perhaps, and to them, that the worst is yet to come. Next slide, please. So yeah, thank you. So this, but there was also very hopeful pictures, very positive pictures, and they want to, they show their resilience. Now, this picture shows circularity at the individual and family level and the resource reuse. This picture from Guleria, Nepal shows one of the early adopters actually who were taking these pictures, and the community also pitched in. Now, the sewerage system in this household has been fed into a biogas pit to generate energy. So you see the picture of a biogas pit, and if picture of a women lighting on the stove from the biogas fuel, and picture of the recycled waste being applied as manure for the flowering plants. Now, it shows the coping is also something that's going on at the individual and family level, and actually finding contextual solutions. Next slide, please. Yeah. So, and this slide actually shows recycle and reuse at the community level. Now, this is a picture from Wa, Ghana, and it's about plural knowledge frames and blending science and community action. The top 2 pictures is of community training session on co-composting importance and safeguards and how to do it. In Wa, Ghana, and the bottom right and center is community-led co-composting, mixing the sewage with other locally available materials to produce manure. And if you see in another part of Africa, this is the next step of that process. A nursery in Tigray, Ethiopia, which is selling plants, flowers, etc. to the urban agriculture, and the women having kitchen gardens. The nursery has also used a similar kind of co-composting initiative. Next slide, please. Yes. So this was a picture taken by the women photograph groups in India and Nepal to underline the importance of off-grid, locally based institutional mechanism to recycle waste and to avoid health crises. And the Kerala picture is of the community-based waste collection workers, and others are from Buleria. So they have understood in their own, through their own lens, the importance of having this, locally localized institutional methods, and they had linked the health and sanitation and the better practices of WASH. Next slide, please. Thank you. So this slide actually shows about access to health, the health of the children. Now this came, top is a picture from Nepal showing OPD timings and rates, people, and then on the right is people walking to a spot where the mobile health clinic boat will anchor. At the bottom, you will see the auxiliary nurse maid making a field visits in a boat, and on the right is a mobile health clinic. Now, this shows how visual methods and techniques can actually record, reflect, and advocate community health issues related to WASH and what they consider essential. If I may quote a participant saying, it saves us a lot of time and money in out-of-pocket expenses if there is a strong community-level healthcare supply network. As most of us are day laborers, traveling long distances to a medical facility means losing a day's wage. And similar words were echoed by her counterpart in Nepal. Next one, please. So this is, I should duly, mention that, the photo credits for and the web links for, most of the resources, but we aim to bring these brave women for the future, conferences like this, and they themselves should speak about their lived experience of WASH. And we see, GS, this Arts for Health as an essential platform to open, solidarity scape, solidarity dialogue, to complement the dominant policy narrative of the modelers, planners, and the policymakers. And this will be our journey towards more plural knowledge frames. Thank you. Next one, please. Yes. So we want to hear from each other about how arts can complement research and how our experience with experimenting and researching with visual methods relating to research on health, water, and sanitation. And we open the floor, and if you can, yeah, please, we'll wait for comments and experiences from the other, people present in this.
Thank you so much, Shibaji. I think it's very wise that we keep on engaging, because I think finding different ways for us to proceed is like a really, really awesome approach. And I don't know, because Hannah had a lot to say I can give you like a few minutes, like 2 minutes, to quickly say a few things if you'd like to add on what Shibaji say, because you were very active in commenting your experiences with the project. If you'd like to, anyway, they may not force you.
I was just, a couple of things around further information, really, if anyone is interested in the work that's really ongoing. So what we're showing you is processes that are very much ongoing, research, not finalized, polished research at stage. So I was just flagging links there for you around arts and sanitation, particularly although there's an evidence base in arts and sanitation in terms of things like singing, how other methods might be used to evidence of sanitation and health situations. So that's where we're looking at the moment. Thank you, Shibaji, for sharing some of this work that's really just preliminary in terms of ongoing findings, and we're hoping the women themselves will be voicing their narratives and very, very soon.
All right, thank you so much. Thank you, Shibaji. Thank you so much, Hannah. It was very interesting to see the initiative and the sort of like how much I'm looking for this word and it's like running away from me. It's like right here. But how much in Afrikaans, we would say betrokken. I have no idea what to say in English now, but that's the word I'm looking for. But I'm only finding it in Afrikaans and not English. But how betrokken the women were within this project, and I think that's absolutely amazing. Well, moving on swiftly, because we have like a full program for you. I keep saying this, but it's almost like people never believe when I say the full-blown program. We have a film screening. So I'm going to hand to gorgeous co-host Franca, who will do the introductions and basically take over for me for a while. I'll see you guys soon.
Okay, thank you so much, Ria, and hello once again, everyone. It has truly been an educative, eye-opening, and enlightening session. I don't know if the word Ria was looking for was incorporation. I don't know if that's what it meant in South Africa, or inclusion of our participants. Something I really enjoyed about the last presenter while he was showing us his slides was how he used terminologies like making up. People would normally consider participants actually researchers, and they were the ones that were also validating the study. So it was quite insightful, because it's a rarity, at least from my end, that people we go into their communities would actually turn out to be the researchers for the project that we are spearheading. So now we have had a very research-oriented evening or afternoon or morning, depending on where you're joining us from. And I would like to slide us in or segue us into a more entertaining / educating segment. As someone who has been in the mental health field for a few years, I am particularly passionate or intrigued by the film screening we are going to view in a few moments. The director of the movies, the director and the producer, they have titled it Gen Z, Mental Health, Climate, Emotions. And it was directed by Tiha Janet of the Stranded Astronaut Productions and produced by Paramount, Climate Mental Health Network, Hollywood Climate Summit, and Impact. Now, the film we're about to view, I would like to let you all know that you'll be the first set of eyes to see it, as this will not be recorded to any of our channels. And it's a short documentary, about 8 minutes, that explores the mental health impact of young adults, Gen Zs, worldwide as a result of the climate crisis. We are in interesting times. And considers what resilience means when fighting for the right to a livable planet. This particular film captures the emotions of a generation that may be frightened, but is in no way hopeless, saving room for stories of love, community, connections, and healing. And like I've mentioned, I will stop the recording or pause it for a while we watch this movie. And I do hope, on behalf of the producer and director, that we all enjoy it and can leave feedback in the chat box while it's being
and I'm sure that you are all now kind of be impacted by this movie. And what I'm telling, this movie is just a glimpse of what's happening in reality. We don't know really what's happening with people who are affected by this kind of disaster. We just witnessed before 2 weeks a major earthquake in Morocco and floods in Libya. So this kind in a very short time period. So this kind of really big disaster initiates kind of an eco anxiety, post traumatic disorders. So it is really important, especially for us now, to talk about this kind of issues. We have to talk about our feelings. We should believe think that we are not safe. So I believe before no one was speaking about these issues, and we kind of denied that we will like witness something like that. But each year we are totally surprised by this kind of events. Like in 2023, we only had a major earthquake in Turkey, wildfires in North America, different floods in Pakistan. So this is really, it's not easy to handle, especially for youth. For youth, it is really difficult for them to have even a hope. I don't know if you noticed in the movie that even youth now are thinking they don't want to have kids. They don't feel they want to bring kids in this world, which I think it makes sense, because what is happening now, it's totally make us in different anxieties. So I don't know if I can share my screen, and we start talk about little about climate emotion, and after that we will have a quick like sessions on how to deal with our feelings in this matter. So I will start by sharing the screen. So I don't know if you are able to see the slides, if it's clear. Is it clear, the slides? Okay. So we will talk about the climate. Okay, climate emotions. I will talk briefly about them. Climate change and mental health. We have to understand that climate change and mental health are highly connected, and we cannot speak about mental health without addressing the climate change and vice versa. Climate change is one of the most significant threats to the health worldwide, and the current and future effects of climate change on mental health and are both underappreciated and understudied. So what are climate emotion? Climate emotion are normal response to the climate crisis and can arise from both direct experiences, such as extreme weather, loss of home or belongings, or indirect experience. And just by watching the news, you can have some kind of emotions. The range of emotion could include anxiety, sadness, traumas, grief, hopelessness, or fear. So you have a range of emotions, that even substance abuse and different kind of violence happening. So I captured some quotes by survivors of different disasters. So one of the survivors said, "You think your house is permanent. When you lose your house and everything you own, you learn everything is temporary." So one of the Hurricane Sandy survivor, and I just know I don't feel real, and home does not feel like home at all. So this is a survivor from Michael Hurricane. We have now the recent Turkey earthquake. It is one of the survivors said, like, our pain is immense. So the pain, you cannot really measure the pain. On one of the Libya flood survivors said, we have lost all our loved ones. So this kind of we are just capturing some of this kind of feelings, which is very difficult really to describe. So to kind of try to cope with this kind of climate change anxiety, there is some things we can do to help. So like try to practice self-care always, and we have to try somehow to disengage with the news. And I'm not telling that to disengage, that we don't know what's and not be aware, but being in continuous exposure to this kind of this news can really sometimes paralyze the way of thinking and how you can see any positivity in life. So we have to have bear in mind these events are really happening, and we have to really collaborate to take any kind of actions. We have to join different actions related to climate change in different, I believe now there is more and more awareness than before. So we have also to focus about to be exposed to the nature. So it's important because nature is highly therapeutic. Just being in nature, it will benefit any kind of mental health problem. We have to use different stress management techniques, like breathing exercise, muscle. We have really to kind of have some digital detox and have to decrease our exposure to stress. What is one of the things that I think is beneficial in this matter, and I would like we have now to start our session. It is like journaling our feelings. So creative writing for climate emotion showed that different studies showed it is extremely beneficial in this matter of eco-anxiety and all different worries. So I'm not sure if you have any, everyone can just grab a pen and paper and just after you watch that movie, I believe there is kind of emotions that came into the surface. So we want to address these kind of emotions. So first questions I would like to ask you, what do my climate emotion sound, look and feel like to me? So if anyone have, you can write anything, you can draw anything, just to express how you feel about this kind of climate emotion. I will just give you 2 minutes and then we will move to the next question. So I'm gonna move to the next question. The next question is talking about list 3 things about the climate crisis that challenge you most and why. So if you cannot like address just what is the most challenges related to climate change, is it like losing your home or losing your family? So what kind of challenges, your work, your business, what kind of challenges you think it is associated with the climate change? If you cannot write 3, it's fine to write 1 or 2. I'm gonna move to the next question. I hope you had answered this one. Who are 3 people I can talk with about my climate emotion? What are the kind of support people you need when you are talking about climate emotion? I will move to the next question. I hope I'm not going very fast. What are some self-care ideas I can use when I'm struggling with the climate emotion? What kind of any kind of self-care do you believe will help you? I will move to the next question. What activities make me feel good? What brings me joy? Sorry, today I'm grateful for. So today, what exactly you are grateful for? I will move to the next question. Oh, this is a good question. How it feels like to hug a tree. I don't know if you had before done that, but what you will feel if you did that. I move to the next question. I think it will be the final one. What are the things that make me feel safe? So this is our last questions for this session. I hope you have finished writing. And I will end up the session. So this is, I consider it as the mini creative therapy sessions. Usually these kind of sessions take longer times and more questions to provoke your any kind of thoughts, because usually these kind of fears, it will be our thoughts, it will be inside different layers. So we have to put in mind that worrying does not take away tomorrow troubles. It takes away today peace. This is one of the most important quotes about how we can deal with worrying. And also, I believe that to heal the planet, we have to collectively heal ourselves. So it's important that we are able to heal ourselves, so that we can heal our planet. So this is. I will stop now sharing my screen, and I hope that you all enjoyed the session. So if you have any kind of questions, you are most than welcome.
Wow, thank you so much, Dr. Dua. I can speak, I think, on behalf of myself and possibly a few others here, that it was quite an calming and peaceful session. And I took the time to actually answer those questions you probed us with. And the one that has stuck with me is the gratitude question. What are we most grateful for? And I saw Anna put in the chat box that she's grateful for the Global South Arts in Health Week.
We are all grateful for this opportunity, really.
You warm my heart. And I even imagine hugging a tree, even though I've not done that in a while.
We have all to do now.
I'm going to do that going forward. But before I share what I'm most grateful for, I don't know if anybody else would be interested in sharing what they are most grateful for. Oh, we have a question in the chat for you. Can anyone host or conduct these sessions, or must they be done by a professional? And also, where can we find more resources to learn more?
So I will drop my email. So if you want any kind of resources and regarding, because it's all from the Mental Health Network. So it is this kind of field, it's really newly and it's emerging. There is not a lot of teaching about it. And we are, for me, it's also, I'm just learning about it day after day, and I am just learning, and because it's now becoming a reality for us, we have to learn about it. So that's why I will start. I'm more than happy to share any kind of this. And if anyone interested to host a session and host this kind of movie in their university, in any kind of in their community, just email me, because this is this kind of movie. It is they wanted to spread it into the world, but they really want everyone. It's because it's not easy. We cannot it cannot be available for the public, because they have a lot of production fees for that movie, so they wanted to compensate. And it is one of the movies that won in the WHO, so it is a very great opportunity to host that kind of movie, and we can help you arrange it, how to host it in any place. So you can, I will just try to put now my email, and everyone, if anyone wanted anything, just email me.
You're so generous, Dr. Zua. And that question also makes
so pick Monday up to Friday. So tell them with the office.
Every time I catch you, say, so I didn't ever want me.
I think, oh, my bad, someone was speaking. So I belong to a mental health organization that educates youth and young adults, and this is a topic I feel that will be truly beneficial to them. So I will definitely be reaching out to you for possible collaboration, so you can speak to the wider audience, and if possible, share the film. Let me just quickly check the chat box if there are any other questions. If anybody would like to share what they are most grateful for.
Yeah.
Right now, I think my biggest gratitude will go to Dr. Dua for taking us through this session. I'm grateful for you.
Thank you very much.
I'm grateful for the good you are doing in our society and in our community. And I'm also grateful to the directors and the producer of that film for using their voices, extending it, and speaking for a cause. It truly has changed at least the hearts of us here. And we hope that they have more strength, more power, more resilience to keep on doing the good work that they are doing. So I'm sure if anybody has any further questions, they would email you. They would definitely email you. So I'm going to allow you go now. Thank you so much.
Thank you very much. Thank you.
Bye.
Bye.
Right. We have had such a wonderful time this afternoon or morning or evening, depending on where you are joining us from. We've moved from researchers to photography presentation to film screening to creative writing therapy. And in all this, I'm supremely grateful to Dr. Ranjita, to Stephanie Chang, to Dr. Shibaji, all our wonderful presenters today who took out the time to share their knowledge, their wealth of wisdom, to inquire of us how to make their work better as well. I've thoroughly enjoyed the Global South Arts in Health Week opening ceremony. being someone that started the session from the first hour down to this time. And I'm going to use the next 1 minute, 30 seconds to give my vote of thanks before I hand over to my co-host, Riha, who is on standby to take us through the workshop session. So yeah, thank you to all our presenters, all our researchers. Thank you to all our audience, both live and both those that will eventually watch this recorded session. Thank you to the organizers of this Health Week, this Global South Arts and Health Week. Thank you to my co-presenter, Ria. It truly has been fantastic going on this journey with you. And I'm looking forward to what the rest of the week is going to hold and the outcome on the impact of this week, and also to the future of Global South Arts and Health Week. We have done magic today, and it's because of all of you. See the power of collaboration, see the power of coming together, see the power of truly being interested in making a change for someone else. So this is from Franca. I'm grateful for you all. And now I would hand back to Ria to take us through the rest of the session. Thank you.
Thank you so much. Isn't it amazing when people just say nice things about you? Can we just breathe it in for a second? Okay, Franca said some nice things about me, and I'm gonna sit here and like just flow. Oh, thank you so much, Franca. It's been amazing co-hosting with you. I am so excited about the next session that we're going to have. One of the most amazing things I think about art is, especially when we speak about it in terms of that third person in the room with you when you are conducting, whether it is art therapy or drama therapy or music therapy. There's a beautiful way in which art becomes the third person in the room with you when you are going through these therapeutic processes. And sometimes it's not as easy for you to actually tell people your thoughts and your feelings when you're just simply dealing with this context of speaking to somebody and trying to like sort of like word vomit all your thoughts and emotions on a red couch, right? And that's sort of like the image that we've always gotten where therapy is concerned. So I'm very, very happy to introduce Mariana Farceta, who is an art therapist from Brazil. Mariana, hi, how are you?
Hi, how are you? I'm very glad to be here.
I've been seeing your face the whole day, literally since before 5 p.m. you were here. So I'm very happy that I'm finally getting a chance, like put you up on the spotlight and like, hey.
Here in Brazil, we have
and then we're also going to have. No, it's okay.
Definitely. I was saying
continue.
Here in Brazil, we used to see classes with our cams open. So I was the only one. I'm very happy to be here.
That is so true. But we're absolutely amazed that you're going to be joining us today. So what we're going to do is something very, very interesting and very, very strange, right? We're going to have breakout rooms that we're about to break out into. Our drama therapist, Bose, is just having a few issues connecting, but he's on his way, he's connecting. But you will see Franca has 2 breakout rooms that are set up for us. So if you want to go into the art therapy breakout room, you're more than welcome to join Mariana. You can even start there if you want to, at the end of the day, at some point, break out into the drama therapy room. That's okay. It's a free Global South. I'm going to say that because I was almost going to say a free country, but we can't say that because it's a free Global South. So you'll see that everybody is unassigned. And there are breakout rooms. There's probably a pop-up that just showed up on your screen. So your job is basically just to say, if you want to click Art Therapy by Marianne, then that's all you have to do. You just have to join Mariana, whose beautiful face we've been seeing throughout this whole thing. Or you can join the theater workshop with Mr. Fonda, and he's going to be joining us in a few seconds. So you can do that. You are basically just allowed to go wherever you want to go. So I'm excited. I'm just going to hand over to you guys in your